This is the extracorporeal life support workshop, which is a joint between two organizations, which is the EuroELSO and the ESICM, European Society of Intensive Care Medicine. And we show here all the ECMO process, starting from the cannulation technique, continuing from talking about priming the system, and then real simulation cases using a high fidelity simulation tool. After that, we go to the attendees went to the water drills to solve problems such as flow oscillations, air entry, and so on. The most important message, regardless we are talking about a lot of machines, is to treat adequately the patient. You should titrate the machine accordingly on the pathology of the patient, for sure, but you should focus on what is happening in your patient and titrate everything: mechanical ventilator, the extracorporeal lung support, extracorporeal circulatory support, and so on, having in your mind what is happening in the body of your patient. Yes. We have had 24 attendees, which means we had a full workshop, and we had a radio between expert and attendee of 2 in front of 6 attendees, which is very important to give adequate teaching with a low ratio. Many experts with not so many attendees to accomplish the big learning objectives that we have also, and to reach this knowledge of attendees, you need this low ratio we used in this workshop.